Production of this podcast.
Good afternoon, ladies and gentlemen. My name is Dr. James Lyons-Weiler, coming to you live from the WWDNYK studios in Pittsburgh, Pennsylvania. Today I have with me a very special guest. We're going to be talking about coronavirus and anything else that comes up. Please help me welcome Dr. David Brownstein. How are you, David?
I'm good, Jack. Thank you for having me.
Yeah, right on. So these strange days indeed. Never thought that the lyrics to that song would ever apply so well to what we have going on today. You're an MD, medical doctor, is that right?
That's correct.
Awesome, cool. So let's get into this. So what I wanted to ask you was, and bring to my audience here, people seem to be negotiating pathways towards recovery from this coronavirus outbreak. And in part of that negotiation, it seemed very difficult to get the ball rolling towards therapeutics for treatment, let alone what I would like is therapeutics for prophylactic use. Could you outline for me your impression of this virus, how concerned people should be? On all the communications I'm on, people want to know what I think about how concerned people should be, and I wanted to bring you on. And I'm not a medical doctor, so how concerned should people be in general about this?
You and I were just talking earlier, and I just put up another blog post today, and the title of the blog post is something like "The fear level needs to be turned down." And I feel like we're at a 10 out of 10 on a fear level as a country right now, and I just don't think this warrants it. And part of the focus is, if you watch the media and you watch the news, I get a stomach ache, and I've turned it off, and I tell my patients to turn it off, and I tell my mother to turn it off, and all they're doing is reporting sensationalism and the worst of the worst case scenarios. And the other problem that I'm seeing is that the media, we're hearing every death that happens in real time. In the regular flu season, there's about 50, 60,000 deaths between flu and pneumonia from influenza-like viruses a year. We don't hear every one of those deaths, real time. And I think if we started in December hearing a patient in San Francisco died of pneumonia, a patient in Colorado died of flu, a patient in Detroit dies of flu, a patient in Texas dies of pneumonia, we'd be out of our minds by the middle of January. And I think that's why we're out of our minds right now. So how serious is this? It's serious. This is clearly a little more serious than the regular flu. We're getting younger people getting lung problems people die from the flu too, but a little bit more in this one. And this one's a little bit more contagious and a little bit harder and faster than the flu, but it's not warranting a 10 out of 10 fear level. And if you take, Dr. Fauci's latest worst case modeling estimates that 100 to 200,000 are going to die at the end of this, which I do not believe. But let's take it for what it is. If 200,000 Americans die from this at the end of this crisis that we're in, that comes out to something like 0.06% of the population. And that means 99.94% of us survive. Now, that's the worst case scenario. I just don't think that without having children dying in the streets or children being paralyzed or people bleeding out of an orifice, in the middle of the streets, and something like hemorrhagic fever or Ebola that kills 40 or 50% who get it, I just don't think this warrants that fear level that we're at right now. And I also don't think it warrants shutting down the country. I'm not minimizing it. This is a terrible illness. I've got friends who have it. I've had patients who've had it. People are dying from it, and healthcare workers are dying from it on the front lines, and it needs to be taken seriously, but not to the point that we're going to ruin our economy over this.
Okay, so how much of this do you think is that they took it too far in terms of there's a mix of hyperbole. There's certain people with agendas to make the American people afraid, and good old-fashioned ineptitude on the part of the CDC to capture this in its earliest stages.
Well, there's certainly no question that we failed miserably as a public health service to our country and not controlling this illness from the beginning stages. We knew it was coming. We knew it was in China. It was not here. China reported unusual pneumonias in younger people and, identified they might have a viral problem. And sorry about that. So we knew the problem was going to come here, and this was our moment to shine as a country. We have a huge public health service. We have public health nurses in every major county across the United States. Every state has public health officials designed to deal with something like this, and there should have been white plans and red plans, and everyone should have a plan in their drawer for this to happen, and this is what we're going to do. And the countries who did it, like Korea, Taiwan, Germany, Sweden, they stayed open for business through this. Yeah, they had deaths. They had terrible illness in people, but they quarantined from the beginning. They researched it hard. They followed people from China as soon as they landed in their country. And, any signs of illness, they quarantined them. They tested, which we didn't do. And now we're in the mess we're in right now. And so we failed from the beginning. I've been writing about this for the last 2 months, saying when the postmortem of this illness comes out at the end of it, it's going to be pretty ugly. And heads should roll at the top of our government, and heads should certainly roll at the CDC, which you're right, failed us miserably.
Okay, so let's take a look at what we're looking at right now, if you can see it. Unfortunately, the LinkedIn article that I wrote doesn't show on this particular browser with the white, but you can see the diagram here. This is the Chinese curve from the day of the onset. And these are all the other countries, including the United States. And this is South Korea. South Korea is flatlined right here. And the big distinction, we need to shoot to be like South Korea. The big distinction here, as you will know, is that the CDC had a test that was available January 16th. Now think what 2 weeks would do in terms of this outbreak, or a month would do in terms of this outbreak. CDC insisted on having their own test. I've written an article about it. I have another episode of Unbreaking Science on this entire fiasco. CDC also then shipped out a flawed test. I haven't seen anyone resign over the destruction of the economy. I haven't seen anyone fired. I haven't seen anyone held accountable. And apparently there's a whistleblower that I reported and talked about on another episode of Unbreaking Science who came forward and said that the CDC lied to Secretary Azar and thereby the president. This person is a former assistant secretary of health at HHS. So the ineptitude put us in the place where we have so many cases so fast that we're really super behind the eight ball. But, people are thinking, okay, well, that's so what? We're in the situation that we're in. And I just want to put the marker on that we're not going to let go of this. We're going to hold those people accountable one way or the other. Peter Hotez wants to say, well, let's do an investigation, but more like, hey, guys, how'd you mess this one up? That's not how this has got to go. This has to go where we basically have a thorough investigation that takes a couple of weeks, and the people that are responsible are fired so we can get other people. If CDC survives this, and that's a serious question. I frankly don't know how CDC could possibly survive this, given that they're destroyed. Their ineptitude destroyed the economy. Their best chance is to blame it on the virus. But this is what I want to talk with you about. People's primary concerns are, what can they do, David, as a medical doctor? What do you tell your patients? What can they do if they feel like they have symptoms of coronavirus to minimize the chance of severe disease?
Well, first off, you are 100% right. I've been reading every one of your articles, and I agree with you 100%. Can the CDC survive this? And they will. And it'll be interesting if nobody's head falls from this. But this was just a disaster beyond belief. So your question, what can people do? Well, besides what can they do once they get sick to prevent getting real sick, they can do things to prevent, look, the treatment for this is support the host. And if the host has a strong immune system from the beginning, if the host doesn't have diabetes, if the host doesn't have hypertension, if the host exercises, if the host isn't obese, if the host doesn't smoke, then when coronavirus comes, we're not going to see the serious illness we're having right now. The statistics clearly show that those who are obese are getting more illness. The elderly, of course, get it more than anyone else. That's just the consequence of being elderly. But Black people are dying more than white people. Black people have more hypertension, they have more obesity, they have more diabetes, they're treated more aggressively with hypertensive medications. The question is, are hypertensive medications, especially the ACE inhibitors and the angiotensin receptor blocking medications, the ARBs, are those making this illness better or worse? I can tell you the studies aren't clear right now, but I'm nearly certain that they're going to show people who are on these medications at more risk, and the coronavirus can get deeper in the body and deeper into the lungs if they're on those medications. So what we really need to do is, this is a wake-up call that our country's not healthy. 2/3 of us are overweight, 1/3 are obese. We have diabetes occurring, as a train wreck in our country right now. We have too many people on blood pressure medicines that don't need them. We need to clean that up first. People need to eat better. They need to drink water and maintain hydration. They need to exercise. If we do all that, we're not going to get hit as hard with this thing. But having said that, in the situation we're in now, we have to deal with, this crisis we're in now. So what do you do? So I've been practicing holistic medicine for over 25 years. I was a conventionally trained physician who bought into what I was trained in medical school to use, which was drugs. And I was taught basically to diagnose pathology and prescribe the drug to treat that pathology, or drugs to treat that pathology. That was my model. Now, I bought into that in medical school, and I went to a residency, got board certified, still am board certified, and began practicing medicine and prescribing all those drugs. And around 6 months into that practice, I just didn't like what I was doing. I mean, I found myself just prescribing drugs. I wasn't thinking much about it. And then I'd have to prescribe more drugs to treat the first drugs. And most importantly, patients weren't getting better. And I wanted a better model. Now, I didn't really know what to do. I was never raised holistically. I didn't take vitamins. I came from a conventional family. We went to the doctor and took whatever they said to take. But once I started researching physiology and biochemistry, and once I started researching the drugs and realizing that these drugs are poisoning enzymes and blocking receptors, and that probably doesn't make people healthy to do that, I just flipped my practice around to trying to teach people how to be healthier, how to make their body stronger, make the host as strong as it could be, and supply the host with the proper nutrients it needs so it can live a normal and healthy life and withstand illnesses like coronavirus and other flu-like illnesses. So besides the preface of eating better and exercising and doing all those things, so you're getting sick. I have 4 partners in practice. I have 2 MDs and then a nurse practitioner and a PA. We have a busy 5-practitioner office. We see a lot of patients. We've seen a lot of patients with flu-like illnesses over the years. We've seen a lot of patients with coronaviruses. We've seen the patients with COVID, a significant amount of them. And our patients seem to weather the flu and the flu-like illnesses, including coronaviruses, very well. None of us can recall a patient dying from the flu in our practice. None of us can recall in the last few years someone being hospitalized for pneumonia from any of these illnesses. And this year, we don't have anyone hospitalized. We don't have anyone with pneumonia, and we haven't had anyone die that we know of. So what are we doing differently? Well, our patients hopefully are, trained to eat better and drink water and do all that stuff. But what we found is a combination of nutrients particularly is helpful. And those combination of nutrients includes vitamins A, C, D, and iodine. And these 4 key nutrients over the years have proven very helpful for our patients at stopping them from getting seriously ill from these flu-like illnesses. Now, they may get colds and they may get flus and they may get, these flu-like illnesses, but they are not hospitalized for them. They're not progressing to pneumonia and they're not dying from them. And when Corona was coming, I kept having meetings with my practitioners and saying, guys, I think we're going to be okay with this. We know how to treat these influenza-like illnesses, and our patients do well. And I didn't have any doubt that this wouldn't work for this coronavirus, which is basically a flu-like illness. And so far, it's proven out. We've seen patients really sick who come to us as new patients. We treat them with these things and maybe some IV vitamin C and IV hydrogen peroxide or ozone, along with the oral nutrients, and they're getting better. And I've been posting videos of people, been writing about this. So I think there's a lot of things you can do. And there's you don't have to just be a statistics. I mean, conventional medicine basically offers you nothing. It tells you to quarantine and doesn't tell you how to eat, doesn't tell you to exercise, doesn't tell you what vitamins to take. It tells you to quarantine and stay away, and then basically, I guess, stay away from the ER as long as you can until you can't breathe, and then go to the ER. I think that's a pretty pathetic way to approach this, and that's why we're in the situation we're in right now. Conventional medicine is pretty pathetic when it comes to this illness.
Yeah, absolutely. So thank you. So if you're out of shape right now, if you've been smoking, if you've been not taking good care of yourself, this is an excellent opportunity to try to get on the bandwagon of your own bandwagon to reduce your risk of poor health outcome with viral infection in general, and perhaps COVID-19 disease in particular. So, yesterday I put out an article that was a pretty exciting article, I thought, that showed that my measure of R naught seemed to be down below 1 in the United States for 4 days in a row. That was really exciting because that means that we're absolutely going to see a day soon, relatively soon, where there's no new cases, if this is an appropriate measure nationwide. I know in Michigan and Detroit, apparently things are out of hand. There's a large cultural diversity on the landscape of people responding or not responding to social distancing. And the title of my paper was "Social Distancing is Working." And David, you read the article and you called me up and you said, "Hey, listen, Jack, I've read all your articles. I agree with most of what you say, but how do you know that this is social distancing that's bringing that curve down?" So let's talk about that. What was your concern?
So I read your article, like I read all your articles, and it was. I was so happy to see the R naught. So the R naught refers to how contagious a virus is, and the higher the number, the more people are infected. An R naught of 4 would mean if you're infected, you can infect 4 other people with it. An R naught of 1 meaning you're infected, that's it. You're not going to transmit it to. You can transmit it to one other person. An R naught of less than 1 means you have a less than 1 chance of transmitting it to another person. The lower it is, the better. When I saw your graph that it was below 1, I was like, wow, maybe we're on the worst of this right now, the very worst of it we're going to see right now, and then we just have to get through the people that have it over the next 2 weeks, and then things should start getting better. And
right.
This is exactly what I've been saying for years that was going to happen. And my call to you was, I said to you, Jack, how do you know it's social distancing? You said that in the headline like it was written in stone, but I said, in my experience, and it's 25 years of seeing patients, the same thing happens every spring. The spring equinox is around March 20th, March 22nd, something like that. And within a couple of weeks of that spring equinox, the flu-like illnesses all fall off in their lethality and their contagiousness. I see it every single year. So my thought process with this coronavirus was, yeah, it's terrible. It started really picking up in the U.S. in the beginning of March. And I felt that within a couple of weeks after the spring equinox, which I think this year was March 22nd, that we would start to see a decline in the transmissibility and the lethality of this. So when I saw your R naught, that prompted me to call you and say, hey, how do you know that that's social distancing and not just this time frame that we're in the earth right now?
Right. So here's the chart, folks. So this is the day from the first case in the United States. Well, 5 days after, because this ratio is the ratio of the number of cases on a given day divided by the number of cases 5 days before, because there's a 4 or 5 day asymptomatic period. And what you see here is kind of a few cases in, I think it was Washington State, and it goes case, cluster, boom. And that's been the case all over the place around the world. with this novel virus. I'm in deep in this, guys, in the molecular genetics of this thing. I'm in deep in terms of the epidemiology, and this is a novel virus. It's not something that's been around. It's not something that's coming out of thin air. We can trace it back genetically, like a pedigree, back to Wuhan, China. And this peak right here is where President Trump said that it is a national emergency. And look, we were almost up to R naught of 6, so people were infecting each other in the United States. This is based on the number of reported cases. That if one person's infecting 6 people, that's pretty dramatic, especially if you have a 4 or 5 day asymptomatic period. Took a nosedive after that because people started doing everything that they possibly could do to reduce transmission, some of which I was talking about in early February. And then it started fluctuating, going back up again because testing came online. And when testing comes online, for about 5 days, you're going to see an increase until you get to a steady state of testing. And now we see this kind of decrease. And I made an article 5 days ago that projected that we would get here in about a week. And it turns out that it was just another 5 days and we're below 1. In fact, we're at 0.55 right now, where we were yesterday. And so, it's a fascinating take on it, that there might be some seasonality to this, and we could, people go read this article, please, and share it so we can have this kind of informed discussion on where we stand. It's remarkable on this day that I published this good news. I went to see if CNN or other news outlets were reporting something that was as equally optimistic, that, look, we at least can see the curve in the road. Right. So the way I imagine this is that you're in a car, your brakes go out and you're on a windy road, and you're dead if you don't see the curve in the road. So it's just incredibly unbelievable to me that there's not a mainstream thing, that a mainstream source that is publishing something like this, so that they can say, this is where we are. This is the effect of our concerted efforts. And so certainly social distancing is more likely than not bringing about changes. There's a figure here in one of my articles on LinkedIn. It's a fascinating figure. I haven't verified its source, but not this one. But it's a figure of all, if it shows up. I hope it's here. Yeah, this one right here. This is from CDC Wonder. This is the month of the week of there's 52 weeks in the year. From 2020 back to 2015, and you can see all-cause mortality itself has a seasonal fluctuation, okay, in the weeks of the year, and then you see this nosedive for this year, all-cause mortality. So people are not getting into accidents in the car because they're not in the car. It's an amazing reality. Social distancing
Wait, one other thing, Jack. So here's another prediction. The all-cause mortality is going down because of less deaths from doctors, since doctors are basically on strike now. There's no elective surgery. Most doctors' offices are closed. People aren't going to be prescribed medications that are toxic to them. So that's going to help the situation, the all-cause mortality too. So you're going to see less iatrogenic deaths. And I haven't written about that, but I've been thinking about that a lot. And then they went down in LA years ago when there was a doctor's strike. The mortality rate went down significantly during that doctor's strike. So wow. That's part of it too.
Yeah, so that's part of it. And so as we're looking at the all-cause mortality taking a nosedive, then there are people that are saying there's going to be suicides. If we're just going to become like bookkeepers on deaths, and we say we shouldn't do social distancing because there's so many people that are dying, that are going to die from suicide, 45,000 deaths, it's kind of a morbid trade-off that, there's fewer iatrogenic deaths, like Dr. Brownstein said, and fewer car accidents, fewer people being caught in bed with their lovers, right, by their spouses, and, there's a lot fewer deaths that are happening overall. So how do you know what the ultimate trade-off is? And it really doesn't help whatsoever that CDC is cooking the books on influenza. You mentioned earlier, and I appreciate, David, that you said that maybe this is as bad as flu plus pneumonia. Well, if you look at the numbers, I just published an article on LinkedIn. If you looked at the numbers, there's now 55,000 deaths from from influenza every year. That's shorthand for influenza plus pneumonia from other causes that we don't know what caused it. Coronavirus could be a cause. And so they may have to trade off the deaths from influenza, because there's only 4,500 deaths every year in the United States from influenza. If there's only 4,500 that can be tracked to influenza with certainty because these are tested patients and so on, then that brings rate of influenza down below the 7% all-cause of death, so it's no longer an epidemic, and it may cost them. It's ironic that I say this in the article, COVID-19 may cost CDC, HHS, and so on their flu vaccine program, because there's no justification if it's really only 0.1% of the population that dies from flu every year, once we get them to actually report all the viruses that are causing pneumonia. And then now they're going to say, well, we need a super vaccine to get back, and we're going to vaccine against everybody all at the same time of all these different viruses or something like that. But the reality is it's impossible to make a comparison in the United States between coronavirus deaths to date when the curve is going up or going down or fluctuating. We don't know for a whole year what it is, and the annual death rate from flu, simply because we don't know what the real death rate is going to be from coronavirus. Add to it that we have inaccurate testing. We have people that are using flawed tests. We have people that are conducting the test wrong, where they're taking nasal swabs out instead of the throat swabs. And the sensitivity of this test is very dependent on where you take your sample. And so it's an absolute mess. So David's, your first message is we should be more readily prepared. I want to propose a heterogeneously physically distributed network of people that are associated with a combination of academic centers that are really, really cutting edge in terms of biomarkers, molecular biology, understanding pathophysiology of disease, and independent medical physicians like yourself that are a rapid response team to outbreaks. And why do we put all of our risk in terms of biodefense in one geographic area with one culture that we know is corrupt anyway, where the first thing they did when they said we have this massive outbreak, the world said, here's a test, it's validated. The CDC said, nope, we want our own. And then they turned around and made a flawed test that put us way behind. So the people shouldn't, Dave, back to the original question, people are concerned about them getting sick. They're now going to take supplements. People are understanding the roles of different supplements. I had a conversation with somebody in Michigan who called me, and they asked me my opinion about their situation. They had a slight cold, and they said, how much should I worry? I said, worry when they put you into the ambulance. That's when you really need to worry, because unless you feel so much pain in your chest that it feels like, in order to breathe, it feels like the shards of glass are cutting your lungs, you probably don't even have this. And so we do need to tone down the panic. We need to tone down this kind of automatic response that because the government says that we need to be socially distanced, that somehow that means we're all going to die. In fact, the good news is, since we're down below 1, we could see no new cases perhaps in a week. If we see no new cases perhaps in a week, then those people who currently have it, they go through their clinical course, and then what do we do? And that's a big question. David, let's say we eradicate this in the United States by social distancing, letting it get burn through the people that make them sick. There's no new cases for 2 weeks in the United States. The rest of the world still has it. What do we do? How do we return to normal?
You and I have been talking about that, and I've been talking about it with my wife and my two medical student children. And here's what I think we do. I think that we made our mistake at the beginning of this. We didn't test, and we didn't quarantine well enough those that had it. We weren't on it strong enough at the beginning. So that mistake has been made. Let's learn from it. So what we can learn from it is now we can, with this R0 going down, and we can start getting the healthy people back to work, and then monitoring and testing and keep testing. And then if people get sick, we quarantine them right away. We test people that are around, and we can get this economy going again without having to keep it shut down for another month. It's not going to work to shut it down for another month. I can feel it. I can feel the frustration that my patients are having. I can feel the frustration that my friends are having. And, people are not going to sit in their houses for another month. There's just not, right. It's not going to work. My feeling is we got about another week in us, and, maybe Good Friday, maybe Easter, which is, a week away. That'll be about it. I think if it goes on that following week, the people who don't have as nice a lifestyle as I do. They're not living in as nice a house. They're poor. They don't know where their next check's coming from. They don't know where their next meal's coming from. I think in a week they're going to have enough, and they're going to take to the streets, and then we've got a bigger problem on our hands. So I don't think President Trump has the time to keep this going. The Michigan governor just added 70 more days of possible quarantining. Stay in your home quarantining. I mean, it's ridiculous. She said she said she can stop that whenever she wants to stop it, but just taking those numbers and making it 70 days makes us all crazier. And I think it's the wrong model. I think I think when you look at other countries that haven't done what we've done, they're still open for business. Our numbers are worse than theirs, and we've shut our economy down. We're going to be paying for this for years. I don't see the wisdom of it, and I think that, it's terrible, and I'm not minimizing those sick people, and I've seen those sick people, and I've, listened to their lungs, and it's not pretty. But, for every 1% the unemployment goes up, I saw a statistic where 30,000 people died. We can't do that. I mean, it's robbing Peter to pay Paul. We need to get healthy back to work. We need to test. We need to test. And we need to quarantine aggressively, and we can get over this and get our country back. It's not as, I don't think it's as simple as just saying, hey, let's quarantine until everyone burns through this, and then we'll just get back to work. Get back to work. You're going to have 50% of small businesses out of business. People aren't going to have anywhere to go back to work.
Right, exactly. So the first people that need to go back to work are the ones that never had any symptoms and test negative. They've been isolated long enough. They can't possibly be infected, right? Let them go back. That's part of the IPAC
100%.
Back to Work program, right? So then the second group of people are people that had symptoms, test negative. They probably didn't have it. Let them go back to work. Third people that can go back to work, and this can all happen at the same time with testing, with accurate testing, rapid testing, are the people that had symptoms tested positive, but then they test negative twice in a row, and I mean a diagnostic test by RT-PCR for 2 weeks. So we need in-home private testing to see if you're immune. The current regulatory climate is you can't know your own immune status against COVID-19 if you're asymptomatic. You have to be presenting illness to be able to be tested, and the FDA won't allow you to know your own status, as opposed to, imagine if the FDA regulated pregnancy tests this way. You're not allowed to know if you're pregnant or not because you have to have a medical physician's involvement to find out if you're pregnant. It wouldn't fly. We need to demand in-home antigen testing to determine if you already have antibodies, and if you're asymptomatic, you don't have antibodies. If you're really concerned and you don't want to affect your coworkers, get your feces tested, because there may be a 14-day time when you're spreading feces. So you're quarantined for 14 days. You're self-isolated, I should say, after you test negative once. During that time, you test negative twice, and then you go back to work. So we could get back to work in a very, very rapidly. There's outcomes here where if you've never had it, and you test negative, you should be able to go back to work today. If you never had it and you're symptomatic but you test negative, why wait? But if you've had it, then you need to wait that 14 days, get a couple of negative tests.
Great.
I'm trying to get that conversation going, and I'd like everybody to go to the IPAC website, ipa-knowledge.org, and find the IPAC Back to Work. It's not perfect, but it should start the discussion. We need to test back to work, but it's not. I don't mean government. Yeah, I don't mean that you have to have government approval or permission. I mean that I would want to know if I was working in a large workplace and I can infect 1,000 people, all of whom are connected to 1,000 people, and there's elderly and people with diabetes. I would want to know, am I bringing this virus in? It's like not bringing your kid to a birthday party if they're sick, right?
You are 100% right. The problem is they're still not testing appropriately right now because they're still limiting the tests to the sick. At least in Michigan there, I've had patients who, they don't meet the criteria, they don't get tested. It's too, you're giving the perfect situation for that. Unfortunately, it's just not going to work at this point because it's too late. I mean, I'm telling you, Jack, I'm giving people a week and a half. They're going to have enough of this sitting at home. And, alcohol sales are through the roof. Marijuana sales are through the roof as people are trying to medicate themselves through this. As this warmer weather comes, this is not going to fly. And the government better come up with a strategy strategy to start opening things up and let the healthy people go back to work. Because if they don't, they're going to be forced to do it when people take to the streets.
Yeah, absolutely. So it would be a worthy investment of companies to order these tests. So that I'm going to put out the name Biomedomics, and Biomedomics as a distributor now in the United States. I have no financial interest. David has no financial interest in this, and it's an antigen test that it's smaller than your cell phone, about a quarter of your cell phone, and you take a blood prick like a sugar test for diabetes, and you put it in a well, and then you put some reagent in it, and then 15 minutes later you either get one line, in which case you're negative, two lines, in which case you're positive, or one line, or three lines in case you're positive. If I owned a company and my livelihood depended, and I employed 6 people, I would pay for the testing for this. It's only $100 a pop. And then, I think I need to start telling people to get a hold of these tests by hook or by crook, and get your people back to work, and let the government settle up later on whether their policy is wrong or what.
There's one problem with that, and I think I read this yesterday. The FDA will not allow that kit to be released. It's out there, and I saw it. And I saw an article yesterday, and I believe the FDA has held back this kit from being allowed to be even being done. So they can't do it right now with us being with how many Americans are self-quarantined? I mean, fully quarantined. It's got to be 80-90% of us. And if you do a test and you have immunity to this illness, you're going to say, I'm not staying home. And
okay, let me update that. The latest FDA guidance, I'll read it right here, allows distribution of SARS-CoV-2 serology. This is March 17th for diagnostic use. So the FDA on March 17th said that, yes, you can get this antibody rapid test. And I just found out that there's a distributor. I'll share that out right now on Facebook, that there's a distributor of this in the United States who's got the license. And so please share that out. When we're looking at whether we have to abide by regulation guidances, that's the other thing. The FDA doesn't often. They publish guidances which are not hard and fast codified laws. You should do it this way. You should do it that way. Medical doctors that are not using this test, if you're a medical doctor and you're going to order these tests, order a bunch of them and then start sending them to people that want to get back to work, and let them take it at home. Give them an instructional video. Make a 15-minute instructional video and show them how to take the test yourself on video. In fact, that's what I'd like to do. If anybody has one of these tests, I would like you to mail it to me, and I will go live, and I will take the test on video and show you how simple it is. And I don't know my status. I was in Seattle. I got very, very sick. I was sick for a month and a half. It wasn't fever and like pain, but I had a cough that just wouldn't go away. And people will remember that from the videos. But if somebody gets a Biomedomics test and sends it to me, I won't source you, but I'll take it online and I'll show everybody how easy it is. We need to use some dramatic examples, and then if everybody starts doing that behavior on video, if you have a video podcast, get a test, show people how to do it. If that goes viral, game over. Then we can get these tests in everybody's hands. It's $100 a test, 15 minutes. I don't know where to get it. I'm not in contact with the medical community except for this good doctor and a few other good doctors, and I don't want to put David in that position. So what do you think, David?
If that's true, the FDA hasn't held that test back. Trust me, I'm going to be looking this weekend for it, because I agree with you. That test needs to be done, because the hell with it. If I test positive that I've had it, which I also think I had it, I missed my first day of work in February for horrible flu. And I was sick for days afterwards. And if I've had it, then what am I going to sit at home for? I don't need to sit at home. I'm immune to it. I can go do whatever I want to do. And there's more people like that out there than we can imagine right now. We just don't know who they are. So we quarantine everybody, and that's just not a smart policy right now.
I agree, David. So make sure you get your supplements, your vitamin C, your vitamin D, higher dose vitamin A than normal, right? I've been telling people to balance their A with D.
So what I found, this was a 25-year project. The meeting that I had with my partners was, hey guys, the first 24 years of our practice, we were just trying to get it right. We got it right for this. We know that it's going to help this, and it has. And we've had really good results with our patients. So what I found was that really high dose vitamin A for a short period of time. So I'm saying 100,000 units of vitamin A, not beta carotene, just straight vitamin. Well, beta carotene can be in there, but 100,000 units of vitamin A. Palmitate is the best version of that. It doesn't build up so much in the liver. It doesn't cause liver toxicity like fish oil vitamin A will. Although you can use fish oil vitamin A for 4 days in these big doses. It just has a dramatic effect on viral illnesses. And, normally in a normal flu season, what I tell patients is take 50,000 units of vitamin D3, 100,000 units of vitamin A day for 4 days, vitamin D3 and vitamin A for 4 days, about 100 milligrams of iodine for 4 days, and then vitamin C to bowel tolerance, at least 3,000 to 5,000 milligrams a day for those 4 days. And at the first sign of a scratchy throat, a cough, a fever, whatever your first sign of being sick is, after you've become sick, then you can just lower down the maintenance doses. And maintenance doses of vitamin D are around 6,000 units a day. Vitamin A, generally maintenance doses are around 1,000 units a day. Because this illness is so serious, I've actually upped patients to 40,000 units a day for maintenance doses of the palmitate version of vitamin A. Vitamin C.
What do you think? Sorry, I got a question about vitamin A. What do you think the mechanism of action of protection against viruses is for vitamin A?
Vitamin A has a couple of mechanisms of action. Number one, it stimulates the white blood cells to become more active and to do their job better. What turned me on to vitamin A was the original work with vitamin A and measles. And it was an ophthalmologist who, I believe was in Africa, was looking at people for retinal problems and was using vitamin A and all of a sudden finding that those younger people who took vitamin A, got over measles really fast and didn't get as sick. And so he did a study and compared a group of kids who took high dose vitamin A for a couple days, beginning of measles, versus those who didn't. And he found that the recovery was dramatically faster. So that was the first viral illness that vitamin A was shown to help. And I kind of stole those doses for treating flu-like illnesses, and it worked. And then it was just refining things with adding vitamin D. Vitamin C I've always used, and iodine was a huge part of this when I learned about iodine. Iodine helps the white blood cells fight infection. In fact, the white blood cells can't produce hydrogen peroxide. They don't have enough they don't have enough iodine to do it. And iodine has virucidal capabilities. It has bactericidal capabilities. There's no virus or bacteria that's resistant to iodine. So the combination of these four things orally have really dramatic effects. And I feel like everyone should have these in their medicine cabinet. And they should be taken under the guidance of a physician. I wouldn't just tell people to take them. But in this case, I've been writing about it, and people are so sick. And we found it very safe to use them for 4 days. And I think it is reasonable to do that. The vitamin A, you got to be a little careful with. It can build up in the body and cause liver problems. But using it for 4 days is fine. And then just doing a maintenance dose of lower amounts of it. But I would suggest if you can find it, use palmitate version of vitamin A.
What's the palmitate version? Could you describe that? What does that mean?
So it's made from plants instead of fish liver, which is the usual form of vitamin A that we're used to. And in an emulsified form, it's absorbed through the lymph system. It doesn't have to get dumped into the liver like the fish oil form. So there's no liver toxicity with it. And I've just seen very good results with it, and I like it just because of the less toxic effect on the liver.
Okay, cool. So I brought up the website here for Biomedomics. So tell people again, testing immediately as soon as possible, right? And before it becomes chaos and people start going on the street unguided by their knowledge of their status, right?
That's correct, 100%.
All right, cool. So, David, you've been a saint and a good man all of your life. I want to take a moment and break from this topic and have you talk about your last 12 books. You got a lot of books out there, right?
I got 15 total. And,
okay.
I started writing books in 1998 when I had flipped my practice to a holistic practice, and I started to see patients actually get better, and they were happier and they got healthier. And I realized that's what I want to do in medicine. And the reason for the book writing started because I'd come home from work and just tell the stories to my wife, over dinner, and she'd say, "Why don't you write a book about this?" And I just started chronicling patient stories, and It's just I wanted to educate my patients on why I think these therapies are better than the drug therapies I was taught in medical school. So I basically just write about what works in my practice, and I know what works because I'm in the trenches and seeing patients on a daily basis, and I can see what works. So, and I've got books on hormones and iodine and salt, um, diet, and other things. But it's just I love what I do in medicine. It's supporting the human physiology is what doctors should be doing versus prescribing these drugs that just poison enzymes and block receptors and disrupt human physiology. And it's a much better way to practice medicine, much more satisfying, much more helpful to the patients.
Where can people find your books?
So they can go to my website. It's www.drbrownstein.com. And my blog posts are there as well. And, go take a look, see what you think. There's enough topics out there that it should interest anyone. And this illness should be a wake-up call for our country that we have been unhealthy for way too long, and we need to get healthier. And, for when this happens again, and this will happen again, we need to be better prepared for this.
All right, I want to ask you, people can see the website here. They can order the books right there. That's kind of cool. I wanted to ask you, David, a lot of people have been asking me to look at ozone as a potential treatment for this. Do you see a connection there at all that you'd like to share?
So I mentioned at the beginning, the oral vitamins, A, C, D, and iodine. Well, the other things that really help for viral infections are intravenous hydrogen peroxide, vitamin C, and ozone. Now, ozone can be given intravenously. It can be given in, intramuscular shots. And ozone and hydrogen peroxide have antibacterial properties, antiviral properties. There's no virus or bacteria that has been resistant to ozone and hydrogen peroxide. We've seen fabulous results with using these items. And ozone in particular is used around the world for its antiviral, antibacterial properties. In Cuba, it's the main source of medicine they use because they need a cheap and inexpensive source of medicine since they can't afford drugs. And they've been pioneers in ozone therapy for many years. In Europe, they use ozone. In the U.S., some of us use ozone, mostly the holistic practitioners. But it is really a cool therapy when people are sick. So ozone has its direct virucidal and bactericidal capabilities to kill those foreign invaders right away. But it also stimulates the immune system to get going to prime itself so we can tackle these infections so it doesn't get overwhelmed with things like COVID-19. What we had our sick patients do when this illness hit was, I had a meeting with my staff, and my staff was really nervous. And, they didn't want to get sick. They, we're all scared at this point. I didn't want, I'm not asking my staff to throw themselves on the fire, for our patients. But, I said to them, look, these patients need help too when they're sick. And, we're in the medical field, and that's what I signed up for when I went to medical school. There's good and bad with it. Am I happy seeing sick COVID patients? No, I'd rather not see sick COVID patients, but that's what you do. And you take the appropriate precautions. And so we didn't want them in the office. So what we do was I tell them if you have a fever, if they have signs of COVID, or I think they have COVID, or we know they're COVID positive, they drive around the back of our parking lot. We come out the back door. I did this yesterday, gowned up in my, full gown, gloves, a mask and a face mask, like Darth Vader. And I went out and I give the patient, I had him on the oral medications. He was feeling better from that, but still coughing a lot and still feverish. Yeah. So I gave him a shot of vitamin C, an IV of vitamin C from the car. I had him hold his arm out the driver's window. And then when we were done, I said, hey, Al, I got an ozone shot here for you. I need your rear end. And people are feeling so sick, they lose their modesty. You just open the car door and, I had him pull his pants down on one end, and I just gave him an ozone shot in the rear end and called him today. He was feeling much better. These therapies can be, very, very dramatic and very helpful for people. This is the time they need them. And they're incredibly safe when they're used appropriately.
Okay, so I know that there's going to be some feedback here on this ozone therapy. There's a person that took chloroquine, which is used in fish tanks, and died, allegedly. people don't take anything that you hear on Unbreaking Science as a prescription to do for yourself. Check out ozone therapy with a qualified physician, and I just have to say that so we're both covered.
No, I'm not saying anyone to take any of these therapies, including the oral therapies. You should talk to your doctor about them before you take anything. Now, this should be a reason for you to go find a holistic doctor, because most conventional doctors don't know anything about these therapies. So I'm encouraging everyone, get a holistic doctor. If you can't get one by telemed. We're doing telemed for new patients right now, and we're helping guiding them through this crisis. And there's holistic doctors out there. It's time we start supporting them and start saying we've had enough of these drug therapies that are just not working and left us overweight and too many drugs, and we got a mess on our hands. And I have a book on ozone. If those are interested, it's called Ozone: The Miracle Therapy.
What's the best way people can get a hold of you for telemedicine, David?
Well, number one, so we like every other office out there, we've had some of our staff uncomfortable to work right now, and they're scared. So we have a skeleton crew right now still working. So we're having trouble answering all the phone calls coming in. So we do have phones, but we're on limited hours right now. So people can email. They can email my website. They can comment to my blogs. I get them, and I post. My office manager's got a special phone for people who want telemedicine consults, and you'll see the comments on the latest few blog posts. Or they can just comment to me, and I'll see them. I see every comment that comes through that website.
All right, cool. I'm going to bring that website up again. Here it is, folks. www.drbrownstein.com. www.
And there's a blog right below this if you scroll down. Scroll down below the screen.
Right on. A lot of good information here. I've visited it often. Yep, and some videos too. Awesome. All right, David. Well, like I said, I want to thank you so much for being part of Unbreaking Science. I think people feel a little bit better today, a little bit brighter, a little bit more hope. I'm going to let you go to your evening, and thank you. It's really an honor to have you, and we're going to have you back again a couple of weeks and see where we're at. What do you think?
Thanks for having me. I'd love to talk to you. You're one of the smartest guys I know.
I get that a lot, but talk to my teenage sons. Well, they're both adults now, 18 and 20. Talk to them. They know I'm an idiot. All right. Thank you, David.
Thanks, Jack.
You're welcome. Okay, so you heard it here that what we need to do is get some form of testing in home, and I want to emphasize that again. Get tested. Even if you haven't had symptoms. How do we do that? You have to change regulatory policy. You absolutely have to contact your senator and your congressman. You have to call them and say that you want regulatory shifting on testing. If you can't get it done at the federal level, start talking to people at the state level. It is absolutely ridiculous. Do you think South Korea got where they got by waiting for the FDA to tell them it was okay to find out their own test, results? Absolutely ridiculous. So that's the message for today. Go back and watch it again and take notes if you missed it. That Dr. Brownstein has some very solid advice on how to use supplements, how to take care of yourself. And if you've been struggling for a reason to take care of yourself and to exercise, to lose weight, to reverse your diabetes and so on, now is a great chance for you to take your time that you have here while you're socially isolated. There's a large number of apps that you can find on your phone that will guide you through a graduated system to get up to speed in terms of exercise. And I want to share a message from a very close friend of mine, Rashawn Golden. Then she says there's 133,000 survivors of coronavirus, and she thinks that we should share that instead of the number of deaths. How many survivors? Well, my reaction to that was, great, that's a huge number of plasma donors for plasma convalescent therapy. We don't have to wait for that anymore. Every doctor can do plasma convalescent therapy right now. So check out the FDA's website and regulation on that. They have to file some paperwork if they do it, but if they only have 4 hours to get it done, they only have a few hours to treat you because you're critically ill. Plasma convalescent therapy. That means if you are a survivor, you should donate blood. How do you know if you're a survivor? How do you know that you are immune and you're carrying antibodies? You need the in-home test, okay? So rather than show up at a blood donation place and get tested there, where if you're negative, you've never been exposed, you could get affected. You can get infected. You don't want to be infected with this because of pathogenic priming. In-home testing is key. We need to change the paradigm of diagnostics for infectious diseases now and forever in the United States. Dr. James Lyons-Weiler, Unbreaking Science, it's been my pleasure talking with all of you. Please share this and like and leave a comment, and let's get this thing rolled out where we're all back to work. IPAknowledge.org, Back to Work program. Talk to you later.
Hi everyone, I'm your host, Dr. James Lyons-Weiler, aka Dr. Jack. In this episode, we're going to review the evidence that science is broken. This is not a news story.
Will be told, people will know the price of corporate science really taking its toll. Whistleblowers blow, public health data low. They say the science is settled, but how do they know?
Science.
Ask questions, critically think, you should try it. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.
You can't deny it, you sure can't buy it. Fact check, use your brain, don't be quiet. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.
Using the tools of the trade to back up what we say. You can't be silent when it comes to unbreaking science. Let's light the truth up, next level ultraviolet. You got a hypothesis, do a critical test. Make an observation without being biased. Use logic and reason mixed with evidence. Look for patterns and results with significance. Calculate the numbers, real accurate, or else your findings won't be legit. Don't cherry pick, but be skeptic. Cause broken science, it makes us sick. That science is being funded by the very same people that run it, so they can promote a product, so they can make that money. Try not to laugh, cause this ain't nothing funny. All these science-like activities, no joke, they call them studies. Hand-picking sample groups and no true placebos. Losing public trust the more and more that we know. The truth will be told, the people will know. The price of corporate science really taking its toll. Whistleblowers blow, public health data low. They say the science is settled, but how do they know?
Science.
Ask questions, critically think, you should try it. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.
You can't deny it, you sure can't buy it. Fact check, use your brain, don't be quiet. It's pure, unadulterated science. Unbreaking science.
Unbreaking science.